This is the story of Out in the Field, where a programme of retreats designed for NHS workers have shown us the power of nature connection and ignited a vision to put care back in the heart of healthcare. Inspired by a wish to thank those on the front line during the COVID pandemic, the Out in the Field retreats at the Quadrangle in Kent created space to rest, recover and recharge. They gave the healthcare workers who came tools to take away to support their wellbeing in their everyday lives. These tools included practices that help us to connect with the natural world, to each other and ourselves. The mental and physical benefits of being in natural landscapes, parks, gardens, under trees and having your hands in the soil has now been recognised. The research shows that spending just 2 hours in a forest using intentional nature connection practices has the power to lower stress levels, reduce blood pressure, boost immunity, enhance concentration and ease depression and anxiety. Nature connection is about feeling, not knowledge. Senses, beauty, emotion, meaning and compassion. These are what are described as the 5 pathways. Phytoncides are chemicals given off by trees and other green plants. They have natural antimicrobial and insecticidal qualities that protect the tree from germs and parasites. A tree emits these substances and creates a field of protection around itself, guarding it against harmful bugs, bacteria and disease. When humans breathe phytoncides in, they positively impact our own immunity and calm us.
The retreat itself was such a powerful experience of using my senses to connect with nature, and I really felt connected and part of something much larger than myself.
Our impact evaluation has shown that the retreats have given the participants confidence that their health and well-being is an essential part of the healthcare system and their care for their patients.
We are in roles in which it is our responsibility to look after other people, and I believe you can't do that meaningfully unless you feel well in yourself. It's just not possible.
I think historically, staff health and wellbeing within the NHS was more known as a nice to have. However, since COVID, particularly the last 4 or 5 years, there's definitely been a better understanding that it needs to be at the foundation of the NHS and is key to recruitment and retention for all staff.
The retreats have created ripples of care, and we know could create many more. Our aim is to build partnerships between NHS trusts, hospitals and GP practices, and the national parks, national landscapes and the National Trust to support access specifically for healthcare workers.
I think every ICS in the country would benefit from having a place like the Quadrangle for staff to go and connect with nature and their teams and themselves.
Our belief is that when we give tools and practices for nature connection, alongside increased access to nature and rural landscapes, it will enable and empower NHS staff to be the champions and ambassadors for nature in our communities.
The retreat days were transformative. The impact has been felt throughout the organisation, and we are incorporating nature into our day-to-day activities at work much more as a result.
Nature can teach us so much about sustainable ecosystems, about cycles of light and darkness, cycles of life and death, wintering, spring through summer and autumn. If nature connections were to become part of our training as healthcare providers, we might inspire and lead the way to a new relationship with the natural world, one that acknowledges we have forgotten something really important, that we are nature.
So this is a call out to landowning organisations, nature conservation charities and leaders in the NHS to consider how to bring nature and health closer together for the benefit of our healthcare staff, our communities and our natural world.